One of the things is sometimes based on where you live, the species can be different and the co-infections can be different, and that may or may not be tested. In terms of the checks, you want to definitely check like the armpit, groin, like areas where it can hide behind the knee and the scalp. Those are like the key areas you're looking at. And then for kids, they're just lower to the ground. So it's just going to be easier for them to transmit, same as pets. And so higher shoes are going to be better if they're wearing like sneakers or higher boots rather than like flip-flops.
If you've been hearing about ticks everywhere and you're finding yourself concerned about your kids being in nature or you're spiraling about Lyme disease, this episode is for you. Today, Dr. Jacquell Patterson and I are digging into everything that parents need to know about ticks, how to actually reduce your family's risks, what to do and what not to do the moment you find one, and the early warning signs of tick-borne illness that too many doctors and parents miss. So Dr. Patterson is a nationally and internationally recognized naturopathic physician and an expert in Lyme disease and other tick-borne illnesses, autoimmune conditions, and PANDAS. She runs a large multidisciplinary integrative medical practice and has served in leadership roles across the field. We're so lucky to have her with us today on the podcast to help us stay calm, confident, and competent as we are in peak tick season. So Dr. Patterson, so happy to have you here on the podcast again to talk about ticks because, they are growing in number this year. And a lot of us, if we even haven't seen one in our lives, are starting to see them or hear about them. So big topic.
Yeah, so the number continues to explode, especially in the past few years. So I'm really excited to be on this podcast, especially also being a new time mom at 46 years of age with my 9-month-old. So
we could do a podcast
your
on
audience is the group. Yes, exactly. Just that conversation alone.
That is excellent. How are you feeling?
Good. Everything has been as smooth as it could be. So we've just adjusted the sleep schedule.
Gotcha. Oh, yeah.
So that's important when we look at like tick-borne infections and infections is the terrain of good rest, good sleep, good obviously diet. So all of those things are really important when we're looking at everything as a whole.
Yeah, well, I'm excited to dig into that. I think what we're going to do today is, I grew up in Wisconsin where we do have lots of ticks, but I grew up in Milwaukee and really didn't have a ton of exposure to, I wasn't hiking, I wasn't in tall grass, I was more of like a city girl. And so I don't even remember ever having a tick on me. Whereas my husband, he lived out in the country, tons of acres, he was in the fields, found ticks on him all the time. And so there are parents that are listening that they may never have seen a tick before, but they're hearing all about it. Or maybe they have seen quite a few in their life and they want to make sure that they're as educated as possible. So I think we can really talk about this topic at a beginner level, but with some integrative medicine tools that even people who are advanced in finding ticks will find beneficial. But before we begin, I would love to kind of hear how you got into this specific field and niche and starting to learn about ticks, because I would say a lot of conventional doctors kind of know the basics of Lyme disease. Maybe it presents like this. We can test and treat with antibiotics, but it takes a certain person to go deeper and really find out the root cause and integrative medicine approach.
Yes, I myself personally had Lyme disease and babesiosa, which is another co-infection. So one things that people don't know is that there's different types of tick-borne infections, not just Lyme disease.
Yeah.
And so I myself had it, my father had it, other family members. And for me, it took a while before I got diagnosed. And that's one of the things with Lyme disease is that for the most part, most people see about 7 to 9 doctors before they get diagnosed. And a lot of new rates of infection are actually children. And there's lots of reasons for that, which I know we're gonna talk about today. So I actually was diagnosed much later, and I became aware as I started actually working with patients that had Lyme disease. And I said, well, wait a second, this is a lot of the symptoms, I was having or I'm having. And so sure enough, I tested, I was positive for multiple infections, got treated. But I would say before that, I started doing a lot of work on just a lot of the basic things like good sleep that I mentioned, good, diet, a lot of stress, a lot of things for support on my lifestyle prior to finding out officially what it was that I had. But just like many of the patients I see, they had seen many different specialists. I saw my primary care doctor, I've seen rheumatologist 2 times, and it wasn't clear what was going on. And so once I got that diagnosis, it made a lot of sense. But the tricky thing with Lyme disease is it mimics so many different symptoms. That's why they call it the great imitator. And so because of that, you can take many years before it actually gets found, unfortunately. So knowing the symptoms, knowing what to recognize early on is really, really huge. Because if you recognize it early on, there's so many things you can do to either prevent it or also proactively to treat it as soon as you find out that you have it.
Yeah. Oh, that's so fascinating. So, a couple of things like backing up. I think a lot of us that are newer to ticks and the diseases really just think about Lyme disease, like you said. But you're saying that there's a lot of different disease that ticks can carry. So, can you explain more, like at a beginner level, what is it dependent on the type of tick? Is it the area you live in? What should we be concerned about depending on where we're located?
Yeah, so there are different species throughout the country. So one thing I like to say is that I'm in Connecticut, right? And so Connecticut was where it was found. So a lot of people just
Okay.
think, oh, it's only in Connecticut, New Jersey, and Massachusetts. But that's not true at all. Actually, almost every single state they have found ticks. There's different species. So for example, on the East Coast, you'll see Borrelia burgdorferi. Whereas if you go
Okay.
out the West Coast, they have something called Borrelia avzeli and basically different species. Now, the tricky piece is that when you do testing, they're not testing in the conventional test for all those different species. So you may have gotten tested for the wrong one. And then there's things like if you're out in the Midwest, like Rocky Mountain spotted fever. If you look at co-infections, most ticks carry about 50% carry more than one infection. So
Hmm.
they may have just tested you for Lyme disease, but you might have Bartonella, or you might have Rocky Mountain, or you might have Babesia. So you might have a different infection that was actually not tested for. So that's one thing to know. And then oftentimes, depending on where you live, like we see patients throughout the country, Florida, Texas, and they may have been dismissed like, oh, there's no Lyme disease here. And that's not true. There are cases every single day of the year too, not just like only in the spring and the summer, every single day of the year. I have people in the city in Brooklyn, they're like, we don't even have grass. How did we get Lyme
Yeah.
disease? I have people, like I said, out in Texas that they're like, my doctor said it doesn't exist, but that's not true. So it really takes seeing somebody, unfortunately, sometimes that's actually proficient in it and is knowing and doing the correct test, and also looking for the different species that might be common and endemic in the area you live. And then also, the ones that transmit it often are from like small rodents. People think it's only the deer, or they think, like you mentioned, tall grass, but a lot of leaf litter and the lower grass levels where you have things called nymphs, which are these ticks that are actually look like a poppy seed. They're that small. They look like a freckle. And they transmit about 70 to 80% of Lyme disease. And the
Interesting.
reason is that you're looking for something really big, like what you'll see in a dog tick. But it could be, one time I found one of myself and I thought it was a freckle on my shin, and it was actually an embedded tick. So that's a lot of information. People are thinking, I'm going to look at this big tick that you take off a dog and that you see, and you might not actually have it. It could be as small as a poppy seed, and it could be hanging out for 2 days and you wouldn't even see it. So there's definitely, I think, a lot more knowledge and awareness, and people are asking to check for it. But one of the things is sometimes based on where you live, the species can be different and the co-infections can be different, and that may or may not be tested.
Oh, that's so interesting. And so, is that maybe in like your case, in some cases where you go to the doctor and you're having these symptoms that could be a variety of different things, but you've never seen a tick on you? Maybe it fell off or got scraped off, or like something happened where you never pulled it off. So you don't identify it. Well, it could be related to that tick. Does that happen? Or in your case, did you ever see a
Yes.
tick on you?
Yeah, so about 50, only 50% of people have a bullseye rash. And then one of the things that people know, so bullseye rash looks literally like a
Yeah.
bullseye, where it's this like red mark and it starts spreading. And that could
Hmm.
spread up to like 12 to 30 days. And it could be small. Some people, it can look
Okay.
like a spider bite. So with mine, when I think back, I had what I thought it was a spider bite when I think back on when the symptoms began. And it can also look different on different skin types. If your skin is darker, if you're
Sure.
tanned, and then again, like 50% don't even have a rash. Some people have it, it can present differently. When you get bit by ticks, it tends to be in areas like the groin, the scalp, areas that you might not necessarily see it. So a lot of things to do is like when you go outside is actually checking those areas, because you're looking for obvious areas like your forearms or your chest or your legs, but it can actually be in areas that are more hidden. And they do that on
Yeah.
purpose because they're going to last longer if they go in
Yeah.
the groin, where you're not going to actually notice it, or under your underarm, right? So that's also on purpose, like to actually be able to transmit what it needs to transmit. But people often will not express with these classic things that you think you have, and therefore you get bit by a tick. You never saw a bullseye, you never saw a rash, and so you think you're safe, and you might not be, because you might start getting these like odd symptoms a few weeks later, after being outside, that those are the things that you're going to look for, but you don't necessarily get a physical sign that you'll actually see.
Oh my gosh, that's so interesting. Yeah. I just think about how frustrating it is if you are experiencing this and just going to multiple doctors and really not getting the answers that you need. So this is such a great piece of information so that we can share some of these things that you can be proactive and look out for, so you don't have to find 8 or 9 doctors in order to understand what's going on and kind of see your symptoms. Yeah. So I think on one hand, we hear this information. I'm exposed to it. I feel like I probably have curated it because I've clicked on things to learn more when I see things about ticks. But seeing it over and over again, and it makes my head, as having 2 boys that want to be in nature and want to go play in the grass and want to go jump in the leaf pile, afraid of those really small ones, right? That we might not see. And also adding in the other mental load of okay, they come inside, and every time they come inside, I have to do a full body check, right? So there is that prevention piece that it's tricky as a parent to know what is the right thing to do, or what are the boundaries that we want to set in order to protect ourselves while letting our kids be kids. So when it comes to prevention, thinking about it from the perspective of a doctor who has seen things and takes it seriously, but also understands the benefits of nature and play and being kids. How do you think about this for your patients and even your growing family?
Oh, and that's a really good point, because I have some parents that get nervous and they don't want their kids outside at all. We know that sunlight, vitamin D, all are good for the immune system, healthy play. These are all really important things that we can't not do that. So some of the things in terms of prevention that I'll look at is making sure they're wearing lighter clothes, like white, so that you can actually see if something is transmitted on the clothing. Wearing protective sprays. So one of the runs we want to look at is things like Ferritin, because you have to be careful with, obviously, we don't want to have them sprayed with a lot of chemicals like DEET and such. And so Ferritin spray has been studied. There are companies like Ready Ranger that have these sprays that are really helpful to put on their skin when they're outside. Wearing hats, and also when they come back in the house, to put the clothing in high heat for 10 minutes. That'll kill off anything. Also, there's essential oils, there's frankincense, eucalyptus, there's many essential oils that can help as well. But I do like the Ferritin spray because it's easy and accessible for a lot of people. In terms of the checks, you want to definitely check the armpit, groin, areas where it can hide, behind the knee and the scalp. Those are the key areas you're looking at. And then the other thing is making sure their shoes, if they go outside, having not, I guess probably I'd say the most comfortable shoes, hiking boots, things that are up higher, because usually it's going to come in through the feet and up, right? And then for kids, they're just lower to the ground. So it's just going to be easier for them to transmit, same as pets. And so higher shoes are going to be better if they're wearing sneakers or higher boots, rather than flip-flops where they can get it on their skin. Although you're going to be able to see it more, it's just going to protect you a little bit more with boots. They do have some companies that will, Insect Shield is a great company to look at for people that have protective clothing, protective wear, but you can actually do things to spray the shoes and things like that when they're outside, to also help prevent the adhesion. Because there have been studies that have shown spraying of the shoes and boots can prevent the attachment, pretty high, about 70 to 80%. So those are great things you can do, especially if they're going outside. These are the shoes you wear when you're going outside in the high grass. And then obviously outside of checking and making sure you have tweezers and all the things that if you actually do see a tick, you can actually properly remove it right then and there. And then the other thing I want to say is, because if you are a person like me or a mom like me that's anxious, is that, for the most part, it doesn't result necessarily in Lyme disease. They usually will transmit, the transmission time is around 24 to 48 hours. They have had some cases where it's transmitted faster than that. But if you do see it, proper removal right away is going to definitely help with prevention. But just because you see a tick, it doesn't mean that it's going to result in Lyme disease. So just to note that, because, it doesn't mean just because there's a tick there that they're going to have Lyme disease, but you want to make sure you take the proper precautions.
Okay, that's super helpful. And as in terms of the frequency of checking, right? So there's times where, like, of course, if you're going to go on a hike, or if your kids are playing in tall grass, or if they're going to an area where it's more likely to have an exposure, of course, you're checking when they come in. But what about if they're just, let's say, playing baseball outside, or they're just kind of walking around in the grass and they're not going into the deep woods? Would you say during some of this like peak
Mhm.
tick season, you still would want to check every time they come in, or is it more just when they're more at risk of being exposed?
Yeah, I definitely would still personally, especially in the peak season, that would be the worst. The peak seasons are going to be May through really July, because the reason is
Okay.
it's like their highest time for reproduction. But you can have like leaf litter, which kids are usually closer to because it's lower before you get into the tall grass, is where you're going to have nymphs and things that are smaller that you might not be able to see. So I definitely would say to check, but I do understand that's hard if they're like coming in inside, in and out of the house all day. I mean, we
Yeah.
actually want that to happen because this generation doesn't do that as much as like,
Yeah.
our generation. So we definitely want the activity, but I would say maybe checking, it might not be every time, but like every 4 hours or, what have you, because as I said, for the most part, the transmission is many hours after time. There are some cases, of course, that transmit sooner, but we definitely want to, I would be looking at like every 4 hours. Like if they're out for an hour, because that is, it's also a process for them. They don't want to do that every time they go in and
Yeah.
out. I would just make sure that you're doing it in certain intervals of time to just help with prevention.
Okay. And at night, before bed is also a good time, right? They're changing into pajamas, so the clothes are already coming off,
Exactly.
just kind of doing the full body check after a day. Because then if it happened, during the day, that's going to prevent it from being attached for more than 12 hours or 24 hours and reduce your exposure too.
Exactly.
Yeah. Yeah.
And
And
also if you have pets, because one of the other big
yes.
ways is pets are carrying, especially if you have pets that are sleeping in your bed, people don't think of that. And kids usually will just always have their pets on them all the time. So that's another
Yeah.
source. So you want to check the pets as well, which is honestly a lot harder, but that just to think of that, especially with your nighttime routine.
Okay. Super helpful. Yeah, it's so hard during the tick season. I'm like, I just really want to snuggle you. I want you to come in my bed, but I just can't. Not right now. Because I have a dog that has black curly hair too. And I'm like, it's just impossible to see. Okay. So let's kind of talk about for the very first time, found a tick on my son. And I had listened to the previous podcast that you've done with Dr. Ilana on the Dr. Mom podcast. So I was prepared enough, but it still is shocking when you see it, right? Because you don't want to see it. So how do you help moms? Like, let's kind of just go through that phase. So your child comes inside, you're doing the check, you see a tick. What does a mom do to make sure she's being as proactive as possible in helping to prevent any illness?
So, everyone will say, don't panic. But I mean, for the first time you have it, you're going to panic. And
Yeah.
that's okay, because I think the first time I bought one, I was like, oh, you think to pull it off. And then later you're like, oh, crap, I didn't collect it. That's
Yes.
one thing I always tell people, try to collect it,
Yeah.
but you're so like, in the instance, you don't
Get rid of
really
it. Yeah.
think of it. So preparing for that. Yeah. So as much as you can is, yes, you might panic in your head, but as many tools as you can have in preparation for it. Because I think that's what happens. Like what's going to
Okay.
reduce the panic is the fact that you have the setup of tools. So tweezers are good. Most people have a pair of tweezers, but they do have, online, there's like tick magnets. There's so many different things to actually be able to remove a tick well. But tweezers, I actually brought a pair of tweezers. You
Okay.
want to
Yeah.
actually take it as close to the skin. And you definitely, the biggest things you don't want to do is you don't want to squeeze it. You
Mm.
don't want to twist it. So a lot of people think like twisting will be a good thing as they're pulling it out. But the reason you don't want to twist it is that you don't want to keep any like legs or anything possibly inside still embedded. So you want to be careful of squeezing it, because it'll actually, sounds gross, regurgitate the
Yeah.
gut, like the fragments into the actual bite. So you don't want to do that. And then also another thing people did, like back in the day, my parents would have like burned it. So they're like, oh yeah, let's burn it off. Or people use oil, like petroleum jelly, like Vaseline oil or an essential oil to put on it before they remove it, because they're thinking, hey, I'm going to put Vaseline or I'm going to put essential oil or something on it so it gets removed easier. Now, that's okay to do after it's removed, but you don't really even necessarily want to do that right after. You want to make sure to clean it with like alcohol and such. But some people will use something before they remove it because they think it's going to be easier, but that's actually the thing you don't want to do. So you don't want to burn it. You don't want to squeeze it. You don't want to like twist when you're pulling it out. And you definitely don't want to use any like oils or jellies or anything to help with removal. And so the biggest thing is you're going to like as close to the skin and you're going to pull it out really, really, really slow, steady, and gently to make sure you're removing the legs fully. And then if you have enough forethought, which I said like the first time I saw one, I didn't. I just was like, throw it away, right away, is to have like a Ziploc bag and to actually collect it and date it. Because if you collect it, you can actually take pictures of it. And if you collect it, you can actually send it out and test the tick to see if it has Lyme disease or some of these tick-borne infections. So Tick Report is a great one where you can actually test it out, and it's going to test for these different species I mentioned. And then sometimes the city that you live in or the state that you live in, you can actually send it to them. Like some of the Department of Public Health will actually test it for you for free. The one thing to know with that, though, is if you do test it with the city or the state, they might only test for like Borrelia burgdorferi only. They might not test for some of those other things I talked about versus like Tick Report might test for a plethora of things or other tick companies. So definitely if you can collect it, put it in a Ziploc bag and test it out, that'll also give you peace of mind because if it has nothing that comes up in the test, you don't have to worry as much. So that's one thing. And then the other thing is you just want to pay attention to symptoms after. So if you have it and you want to see like, does a bullseye rash start coming? Does your kid start having like fever, 102, 101, if they start having a fever, if they start feeling like really lethargic. Some people can even get like nervous symptoms where they get like facial numbness or facial drooping, headaches, any things that seem like abnormal that they hadn't had before in those few days after being exposed. That would be a red flag for getting tested. But the challenge is testing is also faulty at that time because if you do have a tick bite, it's not going to show in the blood for like 4 to 6 weeks. Okay. So typically what's going to happen if you do, like, let's say you remove a tick and there are symptoms that come up, there's like high risk versus low risk. If you remove a tick, you don't see bullseye rash. Again, though, only 50% of people have it, but then there's also no symptoms. You're probably okay, but you want to maybe test 4 to 6 weeks later. However, if you remove it, you see a bullseye rash, they have a fever, they have other symptoms, that's where you want to go into the doctor and they might prophylactically give you doxycycline for the child for a few days. And the reason being that because it's not going to show in blood work yet, but they want to give them treatment. So normally they would be given prophylactic treatment with antibiotics.
Okay. And how long, once you send it out in Tick Report, how long does it take to get those results back to see?
Typically it's about 5 to 7 days. So typically it's about a week. So you'll get it fairly soon. But the challenge is like so you'll know matched with symptoms, but in terms of blood work, you can't check for like 4 to 6 weeks. So that's the tricky part for my parents is like, or just anybody outside of parents, adults is like waiting to find out. And so that's why like prophylactically, if you're not really sure, they might give an antibiotic, but if you definitely are presenting with symptoms, you want to treat.
Okay, gotcha. And then as far as the duration, I've kind of read like 2 weeks. Like it's not just like a 2 days and then you're done. If you really do have Lyme disease, it would be a longer treatment. Is that correct?
And I personally believe that. So a lot of times some doctors will just do, okay, we see it prophylactically, we're going to do 2 days. I don't believe in that. I think if you do it, you should do the full course of like at least 14 days. Typically it's going to be with treatment like up to 3 weeks or 4 weeks. But when they look at the replication, you're looking at in terms of effectiveness, like about at least 12 days. So I usually would say like 14 days if you're going to get it, especially if there's like symptomatic presentation. But normally we're going around like 3 to 4 weeks. Now, the tricky piece is the doctor for children, they usually the first line of treatment is doxycycline. However, with kids, if they're under 8 years of age, it can cause staining of the teeth. And so they might choose to do, people don't know that, but that's a possibility. So depending on what they think, they still might go forward and do doxycycline, but sometimes they'll look at things like azithromycin or amoxicillin or tetracycline, like kind of other secondary options depending on the age of the child as well.
And across the board, because there's a lot of tick-borne illnesses that we were talking about, is that antibiotic treatment the same depending on what the illness is, or are we just talking about Lyme here?
It can vary. So doxycycline is typically the first line for most tick-borne infections. For Lyme disease, for like anaplasma and Ehrlichia, and then also for Rocky Mountain. But if someone has like Bartonella, they would do like doxycycline and rifampin. And if someone had Babesia, typically it's like a tivicone, and they might do that and like an azithromycin or doxy. So for
Okay.
Bartonella and Babesia, they're usually doing two antibiotics versus Lyme disease and the
Okay.
other ones I mentioned, they might just do one.
Okay, that's good to know. And yeah, I'm
Mhm.
like thinking about myself and other moms that listen. We like to be hands-on and do as much as that we can.
Mhm.
So, in that waiting period, whether or not you are seeing symptoms, what are things that we can do besides kind of just looking and watching? Are there things that we can do to support our child's immune system to kind of fight off and be strong during this time, or
Mhm.
things to kind of clean the area that are more effective than others?
Yeah, so you want to definitely do, as soon as it's removed, alcohol and cleaning. And then there are some oils like frankincense is one that you can use. But the other herb I love to do, especially if kids or even adults are outside a lot, is astragalus. So astragalus
Mm,
is an herb. It's for chronic immune function, but interestingly, has been studied as well for Lyme disease. So
okay.
I will, if I have kids that are just active outside with summer camps or just like sports
Yeah.
and things like that, we'll put them on things like astragalus through the summertime because it's one of the ones that you can take like year round, unlike like echinacea or
Yeah.
golden seal. Those are things that are short time frames. But something like astragalus has been studied for Lyme disease, has been helpful for immune function. That's something that I might have depending on exposure on for a time, at least in the summertime. So that's one that I love. They're also just like you want to also do general supportive things like making sure the gut microbiome, especially for kids, like their immune system, 70 to 80% is in the gut. So you want to make sure like a good probiotic they're on so that their gut health is good. So if they do have to mount an immune response, like they have the right things there, the right microbes to be able to do that. But astragalus is definitely one of my favorites. And there are some formulas nowadays. It's called like after the bite formula. There's some glycerites, which Beyond Balance makes, which is a company I like that are better tasting for kids because
Okay.
most of the herbs for Lyme disease are alcohol based, which, as we know, is pretty tricky for kids. So Beyond Balance has a lot of herbs that are more of like a sweeter taste that is a more tolerable for a child to take.
Okay. Oh, that's so interesting. Yeah. It is kind of an ironic twist that like we want to keep our immune system healthy to kind of fight things
Mhm.
off, but I feel like in the summer, kind of during this like peak window, kids are outside doing sugar and it's just I feel like it's
That is true, all the bad things.
I know it's like a season of fun. And so it just kind of is a good reminder of like, okay, we can have balance, right? We can have a little bit of
Mhm.
fun, but also trying to really keep the immune system resilient so that if it comes into contact with something like this, it can help work through it a little bit easier
Yeah, and I
too.
always say the summer is harder for like lifestyle changes too.
Yeah,
I think it's harder than the winter time because people always think,
in some
oh, the
ways.
winter time, the holidays, because everyone's getting together. But I feel like the summer because it's fun. There's cookouts, there's barbecues,
Yeah.
there's parties, there's events, there's like a lot of easy fast food, like fast food access, like easy foods to consume, not
Yeah.
harder, complex meals. So just being mindful of like how you're still supporting all those like good basic foundational support for them too. As good of a job because I always
Yeah.
believe in balance of all of those things too. So
Yeah. Yeah. And then kind of thinking like more like long term. And as you talked about in the beginning, maybe some of the symptoms, like it wasn't clear, there wasn't a bullseye rash, like you don't remember seeing a tick on you. And all of a sudden you're noticing some like key symptoms that could be overlooked and doctors aren't really sure what it is. What are some of those symptoms that if we're getting dismissed or we're starting to be kind of concerned because it is more chronic, we should be on the lookout for?
that's a really good question because I have that with a lot of the parents that come to see me that they'll
Yeah.
say, my child, I feel like has not been themselves in the
Yeah.
last 6 months and they went to their doctor. And one of the biggest things I see that's like kind of long term is like fatigue, where they'll say, I have fatigue. The child has fatigue or a lot of like physical pain. And then when they go to their doctor, they might say, well, that's just growing pains.
Mm,
And then the parents like, okay, but they're having it all day and it's for long periods of time. Usually with growing pains, it's going to be a little bit cyclical and it's
yeah.
not going to be all day or it's not going to keep them from doing activity. So I'll have a parent that'll come in and they're like, they stopped wanting to do activities because they're in pain. I'm like, there's something else going on. It's limiting their level of activity or they're not wanting to participate in things. I have parents will come in and the child is like 5 or 6 and they're sleeping the whole intake. I'm like, this isn't normal for a 5 or 6 year
Yeah.
old. They should be bouncing around. So that's always a red flag is like there's a lot of fatigue or a parent will say the child's 3 and the kid keeps asking to be picked up all the time. They didn't used to get asked to pick up all the time. They can't walk as long. They say their legs feel funny. Things like that, just paying attention to that are kind of different and for a longer period of time. If it's happening for a week or two, that's different versus, hey, this has been months and they've been complaining about that. And then exposures like afters, of course, we're looking at like fevers and significant like symptoms like neurological, like I had mentioned, like facial changes or really significant headaches. Like those are the things you're looking at in those first couple weeks. But some of those symptoms that can come after are joint pain and fatigue that feel like they've been for a longer duration of time than what would be normal. And so that's one of the things. They go to the doctor, they do blood work, things come back normal, but they're like, something is wrong. That's when you want to say, hey, can we test for other infections like Lyme disease? Do you want to test for, there's other infections kids can have like mono, strep. There are other like chronic infections that they might have. So Lyme is definitely one of them, but you want to definitely get worked up for other possible infections they can have that can be causing some of the symptoms they're having.
That's super helpful. And that's not something that a lot of conventional doctors are well versed in, right? So in your experience, is that something that people would have to come to somebody like you that is like Lyme literate or, chronic stealth infection literate to do that more proper, thorough workup?
So usually
Yeah.
so and so one reference is you want to look when you're looking at languages like Lyme literate. So
Okay.
usually somebody that has experience in Lyme disease will say Lyme literate, or you'll see what you would mention like complex chronic illness or
Yeah.
stealth infections. But you still can push the pediatrician. They're like, hey, can you work up Lyme disease? Even if they say that doesn't exist, or I don't be like, okay, that's fine. But you should feel like you can advocate. If you can't advocate, honestly, you should probably consider
Yeah.
looking at a different provider. That's my
Yeah.
opinion. If you're asking for things and it's being dismissed, you really want to work with someone that you feel like hears your concerns and it's balanced. Also, some of these symptoms can mimic even like anemia, iron deficiency. So sometimes with kids too, I'm asking to check on some of those core nutrients because
Okay.
oftentimes they'll just do a CBC, which is a red blood count, but they don't test like iron and ferritin by itself.
Okay.
And for a child that's iron is low, they can get headaches, they
Oh
can get
yeah.
fatigue, they can get muscle cramping and muscle pain. And in fact, actually, infections will also make iron levels lower, like ferritin, because ferritin is related to like inflammation. So sometimes you'll see both of those together. So I also tell parents to push to ask not only test for infections, but also to test iron and ferritin by itself.
Okay, that's super helpful. Yeah, and I feel like, sometimes in the conventional world, I hear from providers that it's like there's concern over running those additional tests for like a couple of reasons. One, maybe insurance won't cover it or it might be a little bit more expensive, or B, like not being sure what to do with the results, right?
Mm-hmm.
And like to create this holistic protocol that can really address some of these concerns too. So I do think it is, if your gut is telling you something is off, like it's not just growing pains or it's not just maybe them being tired from sports or like a big day at the pool, like it's more than that. I feel like a lot of us know, like the gut
Mm-hmm.
is,
Oh
we
yeah,
just
I
got to find
always
the right
say that.
provider.
I always say
Yeah.
that with moms, and they'll suspect. I'm like, you know what? Every time I haven't had that really lead wrong. So if a mom is suspecting, I'm like, we're gonna go test.
Yeah.
If they have a feeling. But you're right. Sometimes it depends on like that they're doing the right coding, have the right symptoms. Things like fatigue, iron will fit into that. So that
Yeah.
should be fine. That is true because the doctors may not run because that's not necessarily their area of focus of like, what do I do next?
Okay, is there anything that we didn't cover today that parents come in and ask you about when it comes to Lyme disease, or you see all over social media that you want to correct here so that moms have the right information? Is there anything we left out?
I think the biggest thing is that if you do suspect it, you may be told right away, like, this isn't Lyme disease, or, well, we don't have it here. And I will say, again, almost every single state has found a case of Lyme disease. And so I really want to reiterate that because many people listening are from all over the country and they're told that Lyme disease doesn't exist in their state. And that is absolutely not true. And one of the reasons, sadly, I see people throughout the country because the doctor wasn't proficient or had told them there's no Lyme disease here. So that's the one big piece that you want to look at. And then just being aware, like do as much as you can, prevention, the checks I said to the end of the night, like you had said, but what things they can do by way of clothing and prevention. But also balancing it with like, not being fearful. And, it's important again to play and to be outside. And if you do see it, making sure or at home having proper preparation, like the tweezers and things available so that if the event that does happen, you're able to know what to do and you actually have the equipment and the things available to do it the right way.
Yeah, I love that. I love that. It really is a well balanced, centered approach of yes, ticks are out there. We know things that we can do to help prevent them from either attaching or attaching for a very long time. We know that there's resources and doctors like you that are amazing that can help us work through it if we have questions. And there are tools in our cabinet through working on our gut and getting sleep and eating nutritious food and taking things like Astragalus that can help support our immune system to do the job that it's meant to do to fight these off. So thank you so
100%.
much for your time today. This was really informative. Conversations about ticks usually give me like a little bit of goosebumps, but I feel very calm and confident talking to you and knowing that we have a strategy that we can use as parents to be outside
Yeah, that's the
and be
best we
safe.
can do. That's the best we do. This as much strategy, as much preparation, and then what happens happens from there, right? That's
Yes,
all we can do. But way more knowledge and more education and preparation is everything, and asking the right questions with the doctors that you have.
absolutely. Wonderful. Well, where can people find out more about you and maybe reach out to you to work with you if they want to connect with you about their child and what they're seeing?
Yeah, sure. So our practice is Fairfield, Fair Field, familyhealth.com, and we have 8 different providers, half of which are actually very proficient in Lyme disease and work with pediatric health. So I am at that practice, and if you guys follow us on Instagram and Facebook at Fairfield Family Health, my also personal Instagram handle is at naturopathic.physician. So love for you guys to follow me, and then if definitely connect in. We see people again throughout the country for services.
Amazing. Thank you so much for your time today. This was really wonderful.
Thank you so much for having me. I love this discussion as always.